Bismillahirrahmanirrahim. Today we are going to discuss the blood and circulatory system. So the heart is the most important pumping station of the body, which circulates the blood in whole body. The heart is mostly responsible for pumping, whereas the circulatory system and the respiratory system both works, and each breath brings the oxygen-rich air into the body. Red blood cells are responsible for carrying the oxygen, and the hemoglobin binding capacity is responsible of carrying oxygen from the lungs towards the body. Heart delivers the oxygen to the cell, whereas the circulatory system and the respiratory system work together uh, to supply the oxygen to the cell, not only the oxygen, but also the nutrients, and they are needed for living alive, these cells. Mostly the cardiovascular system is depending, and the vital organ of the cardiovascular system is heart. That is located near the center of your chest, or even in the chest of the uh, animals. So different animals carries the different size of the heart. Again, depends on the thoracic cavity and as well as the size of the animal. A hollow organ about the size of your fist, composed of a cardiac muscle. In a human, and the size of the heart is uh, almost or approximately equal to your fist. When you are closing your fist and the palm, then you are developing a size that is equal to your fist. So heart is being approximately measured uh, like a fist. So it is enclosed in a protective sac of tissues called pericardium. The first layer, the covering layer of the heart, the uppermost layer of the heart is known as a pericardium. And inside there are two thin layers. One is the epithelial layer and the connective tissue layers that makes the pericardium. Whereas the contraction of the heart depends on the myocardium. A thick cardiac muscles, known as the cardiac muscles or heart muscles, pump blood through the circulatory system. The pumping of the heart is depending on the cardiac muscles. So the heart is pumping on the basis of a cardiac muscles. The heart contracts about 72 times a minute, and each contraction pumps about 70 ml of the blood in the heart. The location of the heart is in a thoracic cavity between the lungs, pointed apex directed towards left hip and about the size of your fist. The heart has a on the left side the left atrium and the left ventricle. On the right side, the right atrium and right ventricle. So the both the left and the right is separated by a septum or a wall, separates the right side from the left side, preventing the mixing of oxygenated blood with a non-oxygenated or a poor oxygenated blood. So the flaps of a connective tissue called the valves divide each side into two chambers. So right side is divided into two chambers, the right atrium and the right ventricle, whereas the left side is divided with a left atrium and left ventricle. So there are two chambers on the right side and two chambers on the left side. So upper chambers receive the blood. The right atrium receives the blood from the body, whereas the left atrium receives the blood from the lungs, whereas the right atrium delivers the blood to the lungs, and the left atrium delivers the blood to the body. So the lower chambers pumps blood out of the heart, whereas the upper chambers pumps or receive the blood from the body or from the lungs. So the pericardium, the coverings, a double serous membrane, visceral pericardium next to a heart, and parietal pericardium outside a layer of the heart. So serous fluid fills the space between the layers of the pericardium, whereas in the broilers it is known as the pericardium, hydropericardium disease, which fills with water instead of a fluid. So serous fluid is filled in between these two visceral and parietal pericardium layers. So common disease is known as hydropericardium in the broilers. Well uh, known and uh, commonly observed by the veterinarians in working पोल्ट्री साइड जो पोल्ट्री साइड पे वेटनेरियंस हमारे काम कर रहे हैं तो ये हाइड्रोपेरिकार्डियम उन्होंने रिपोर्ट किया था कि पानी भर जाता है पेरिकार्डियम में. So the third layer, the heart wall of a three layer epicardium means outside layer. This layer is the parietal pericardium connective tissue layer. Myocardium is a middle layer, mostly a cardiac muscles, and endocardium is inner layer, which is of endothelium. So the external heart anatomy, if you see from the left common carotid artery, left subclavian artery, aortic arch, then the ligaments of the atrium, the left pulmonary artery, left pulmonary vein, left atrium, auricle, then the circumflex artery, left coronary artery and coronary sulcus, whereas the left atrioventricular groove, left ventricle, then there is a great cardiac vein, then interior intraventricular artery and apex. If you go with the right side, then you will see that the bronchocephalic artery, superior vena cava, right pulmonary artery, and then the ascending aorta, pulmonary trunk, right pulmonary vein, right atrium, right coronary vein. Then you have to see that the interior cardiac vein, right ventricle, then the marginal artery, small cardiac vein, and inferior vena cava. So there are the heart chambers, right and left side act as a separate pumps. So the four chambers, atria, receiving chambers, right atrium and the left atrium, ventricles, discharging chambers, right ventricle and left ventricle. If you see that the pulmonary circulation, if the pulmonary artery supplies the deoxygenated blood and then the capillary beds and of your lungs uh, doing a gas exchange, and then you are receiving the heart on the right side is receiving the pulmonary vein or aorta of a branch is carrying oxygenated blood towards the body, and as well as the pulmonary vein is uh, uh, supplying the oxygenated blood to the left atria, and then it is going to a left ventricle, and then it is supplied to the body. Whereas the right atrium is receiving the blood from the inferior vena cava and superior vena cava to the atrium, and then it is received by a right ventricle, and then it is deoxygenated blood is provided by the veins to the heart and by the artery to the lungs. So the artery is working in the pulmonary section or a pulmonary circuit, vice versa against the systematic circulation. In the systematic circulation, you see that the veins are carrying the deoxygenated or poor oxygenated blood to the heart, whereas the pulmonary artery the supplying the poor oxygenated blood to the lungs and then purify and supplying the oxygenated blood by a vein to the heart, and it is being carried by a artery to the body, and then oxygenated rich blood is showing over here with a red color, whereas the poor oxygenated blood is shown in a diagram with a blue color. If you see that the heart valves allow the blood to flow in only a one direction, four valves, atrioventricular valve between the aorta and ventricles, bicuspid valve left and tricuspid valve on right side, semilunar valves between the ventricle and artery, so the pulmonary semilunar valve and the aortic semilunar valves allows the one-way uh, blood supply to the from the body to the heart, and from the heart to the lungs, and again to the heart and then to the body. So the valves open as the blood is pumped through, held in a place by chordae, tendini, heart strings, closed to prevent the backflow. So you can see that the operation of the AV valves. So the blood is returning to the aorta and push the portion against the AV valves. The AV valves are forced open as the ventriculus fills. The AV valves flaps hang and empty into the ventricles. So aorta contracts and forcing the additional blood into the ventricles. So the ventricles contracts and forcing the blood against the AV walls flap, and the AV walls close. So this chordae tendinous that tighten and preventing the walls flaps from the everting into the arteria. The as the ventricle contracts and intraventricular pressure rises, blood is pushed up against the semilunar valves and forcing them open. As ventricles relax and intraventricular pressure falls, blood flows back from the arteries, filling the uh, leaflets are semilunar valves and forcing them to close. So this is the one-way pressure which pushes and pressurizes to flow the from a right atrium to the right ventricle, and then flows to the pulmonary artery to the lungs, and then received by a pulmonary vein to the heart, and then it flows to the atrium, and then it comes into the ventricle and it goes to the body. The heart-associated great vessels, aorta, leaves the left ventricle, pulmonary arteries leave the right ventricle, vena cava enters the right atrium, and pulmonary vein, four veins that enters the left atrium. In the coronary circulation, the blood in the heart chambers does not nourish the myocardium. जो कोरोनरी सर्कुलेशन है, जो दिल को ब्लड सप्लाई होती है, वो अलहदा एक सिस्टम है. डायरेक्टली द हार्ट इज नॉट nourished from the blood which is pumping inside the heart. वो जो पंप करता है ब्लड चैम्बर्स में, उससे ब्लड सप्लाई नहीं मिलती. वो ब्लड डायरेक्टली consumed नहीं होती for oxygenation and nutrition to the myocardium, but there is a special supply to the heart, which is known as the coronary circulation. The heart has its own nourishment circulation. That's the coronary arteries and cardiac veins. So blood empties into the right atrium via the coronary sinus. The heart conduction system. Intrinsic conduction system is a nodal system. Heart muscle cells contract without nerve impulses in a regular and continuous way. Special tissue cells, the space sinoatrium node, pacemaker is known. The atrioventricular node, AV node is known, whereas the atrioventricular bundle branches, and Purkinje fibers. They are responsible for a conduction systems and they are the part of a conduction system. So the heart pumps automatically by without the supply of a impulses from the nervous system. So this heart pumps the heart cardiac cycles pumps like arteria contracts simultaneously, arteria relaxes, then the ventricle contracts, so it creates the systolic sounds known as a contraction sound and diastolic sounds, which is created by a relaxation. So we are measuring the blood pressure in the systolic and diastolic measures. So this contraction develops a higher pressure systolic and the relaxation diastolic pressure is mostly 70 or 80 mmHg, whereas the systolic is a 120 to 130. It mostly develops by contraction and the superior vena cava, arterial node, the arterioventricular AV node, the right atrium, bundle branches, Purkinje fibers. So it is the contraction is initiated by the sinoatrial node and sequential stimulation occurs at other autorhythmic cells. So the left ventricle atrioventricular bundle or bundle of his and Purkinje fibers and intraventricular septum. This is the conduction system which creates the rhythmic contraction and relaxation of the blood. So the filling of the heart chambers, the cardiac cycles, so left atrium and the right atrium, left ventricle and right ventricle. Ventricular filling, arterial contraction causes the ventricular filling, and this is the mid to late diastolic ventricular filling. Whereas the isovolumetric and the ventricular contraction phase ejection phases that causes a ventricular systole or atria and a diastole, whereas the isoventricular relaxation causes the early diastole. So this is the diastolic pressure which is developed and that produce the diastolic sound and the systolic sound by contraction and then by a relaxation. So these two sounds are developed, which is known as a lump, lub and dub. So these sounds are uh, produced by the heart and which can be heard by the stethoscope, and this pressure can be measured by a BP apparatus. Pulmonary circulation from right side of the heart to our lungs, where the carbon dioxide leaves the blood and oxygen is absorbed. So you are knowing that the pulmonary circulation that is in between the heart and the lungs. जो आर्टरीज डीऑक्सीजनेटेड ब्लड लंग्स की तरफ लेके जाती हैं, ऑक्सीजनेटेड ब्लड वैन्स जो है ना हार्ट की तरफ लेके जाती हैं, तो वेंट्रिकल से ब्लड जो है वो लंग्स की तरफ जाता है और फिर लंग्स की तरफ आर्ट्रियम में ब्लड आता है. तो दिस सिस्टोलिक सर्कुलेशन फ्रॉम लेफ्ट साइड ऑफ द हार्ट टू organs. Though this pulmonary circulation, again, as I told you, that the ventricle, the left side of the ventricle supplies the blood to the organs or to the body. The coronary circulation through heart tissues, and the pulmonary circulation, the right side of the heart pumps blood from the heart to the lungs, whereas in the lungs, carbon dioxide leaves the blood while the oxygen is absorbed. Um, the oxygenated rich blood goes into the left side of the heart, into the left atrium, and then goes into the left ventricle, which supplies the blood to the organs. Whereas the superior vena cava, the inferior vena cava, it supplies into the atrium on the right side, and then it goes into the right ventricle, and then it supplies to the uh, right to the lungs by a pulmonary veins um, and pulmonary arteries, and then the oxygenated the blood oxygenated is carried by a pulmonary uh, vein, and then pulmonary uh, arteries is supplying to the body. So this circulation is known as a systematic circulation, when the blood supplies from the body to the heart, and from the heart to the body is known as a circulatory system. Whereas the blood supplies to the lungs and from the lungs to the heart is known as a pulmonary circulation. The circulation which is supplied to the heart for the nourishment and oxygenation of the heart is known as a coronary circulation. So the oxygen poor blood returns to the right side of the heart, whereas this blood is oxygen poor because the cell absorb the oxygen and release the carbon dioxide into the blood. The oxygen poor blood is ready for another trip to the lungs to get the oxygen again. So the circulatory system, as you see that the external jugular vein, then the internal jugular vein, and then internal carotid artery and external carotid artery, then the subclavial artery and subclavial vein, superior vena cava, then the inferior vena cava, pulmonary artery, pulmonary vein, aorta, the cephalic vein, uh, diastolic vein, then the renal vein, uh, tibial iliac sac vein, or even the cephalic vein, femoral artery, or even the tibial artery, or even uh, the tibial vein, and as well as interior tibial vein and posterior tibial artery. So you can see that the circulatory system, and that the capillaries head and arm supplies the superior vena cava and the pulmonary artery, then the pulmonary vein, capillaries of the right lung, and the inferior vena cava, the capillaries of the lungs, and then the capillaries of abdominal organs. This is a circulatory system where it is the blood is in circulating all over the body. And remember, the heart is an organ and needs nutrients, oxygen, and creates the waste products. So the blood flows to the tissues of the heart too. And the blood flows through the heart. The blood leaves the heart in arteries, and blood returns to heart in veins. Oxygenated blood returns from the lungs through the pulmonary veins to the left atrium. Oxygenated blood is pumped from the left atrium through the mitral valve to the left ventricle, whereas the oxygenated blood leaves the left ventricle through the aortic valve to the aorta, which is the largest artery of your body. The aorta branches into the various arteries pumping blood through your blood. The deoxygenated blood returns from the top of your body through the superior vena cava, and from the bottom of the body through the inferior vena cava to the right atrium. Then it goes to the deoxygenated blood is pumped from the right atrium through the tricuspid valve to the right ventricle, whereas the deoxygenated blood leaves the ventricle through a pulmonary valve to the pulmonary artery. And the pulmonary artery pumps the blood to the lungs to absorb oxygen and release the carbon dioxide in the lungs. This is the path of a blood that the superior vena cava, right pulmonary artery, a pulmonary valve, sinoatrial valve, atrioventricular valve, right atrium, tricuspid valve, right ventricle, inferior vena cava, aorta, pulmonary artery, left atrium, aorta valve, mitral valve, left ventricle, ventricular septum, and descending thoracic aorta. So if you see that the blood enters into the arteria of the heart, separated from the ventricle by a valves, preventing the backflow of the blood, keeping the blood flow in one direction. When the arteria contracts, the valves open and blood flows into the ventricle. When the ventricles contracts, the valves close, preventing the blood from flowing back into the arteria, and then the blood flows out of the heart to the lungs. So at the exit of the ventricles, there are the valves that prevent the blood from the flowing back into the heart. So therefore, the lug and dub, the sound of your heart is caused by the closing of the heart valve. The lub is when the ventricles contracts, blood being forced against the atrioventricular or AV tricuspid or mitral valve. The duct is the blood being forced against the semilunar aortic or pulmonary valve. So this is the left atrium, left ventricle, right ventricle, and in between the atrium and ventricles, there is a septum. So the superior vena cava, that's the large vein that is a oxygenated poor blood is being supplied to the lungs, and it is being provided to the uh, right atrium, and then the pulmonary vein carries the deoxygenated blood from the ventricle to the lungs. Pulmonary valves are being opened to carry a one-way move of the blood, whereas the tricuspid valve, when opens, it allows the blood to flow inside the ventricle, and then inferior vena cava is also supplying blood uh, into the atrium, and then it flows in a one-way direction to the right, from a right atrium to the right ventricle, and then by a artery, the deoxygenated blood supplies by pulmonary artery to the lungs, and then the aorta again brings the oxygen-rich blood from the left ventricle to the rest of the body. Pulmonary arteries brings the oxygenated poor blood to the lungs. Left ventricle receive the blood, oxygenated blood from the lungs, and the aorta valve that prevents the blood from flowing back into the left ventricle after it has entered the aorta. So mitral valve, prevents the blood from flowing back into the left atrium after it has entered the left ventricle. So the left ventricle receives the blood from a left atrium, and then it supplies the oxygenated blood through arteries to the body or to the organs. There are two muscle contractions in the heart, the atria, the ventricles. Each contraction begins in a small group of cardiac muscles in the right atrium and stimulates the rest of the muscles, sinoatrial node, as a node which is known as a pacemaker. Since the sinoatrium node sets the pace for the heart, it is also called a pacemaker. The impulse spread from the pacemaker through a fibers in the atria to the atrioventricular node and through a fibers in the ventricles. The atria contracts blood flows into the ventricles. When the ventricles contract, blood flows out of the heart. So you can see that the contraction of the arteria and contraction of the ventricles. Changing of your heartbeat, and your heart can beat faster or slower depending on your body's need for oxygen-rich blood. When you exercise, your heart rate can increase to 200 beats per minute. The autonomic nervous system influences the heart rate. Neurotransmitters released by neurons in the sympathetic nervous system can increase the heart rate, and those released by the parasympathetic nervous system can decrease the heart rate. Blood vessels. The blood circulates in one direction and it is moved by the pumping of the heart. A blood flows from the circulatory system. It moves through the types of blood vessels like arteries and then the capillaries, veins, and then the capillaries. So the arteries, large vessels that carries the blood away from the heart to tissues of the body, and except the pulmonary artery, all arteries carry the oxygenated rich blood. Yeah, arteries has a thick walls of the elastic connective tissue, contractible smooth muscles, and epithelial cells that help them withstand the powerful pressure produced when the heart contracts and pushes blood into the arteries. The capillaries, the smallest of the blood vessels connecting arteries and veins, the walls are one cell thick, allowing for easier diffusion of nutrients and oxygen from capillaries to body cells and waste and carbon dioxide from body cells to the capillaries. Veins returns the blood to the heart, and veins have a walls of the connective tissue and a smooth muscles. Large veins contain the valves that keep blood flowing towards the heart, and many veins are located near the skeletal muscles. So when the muscles contract, they help force the blood through the vessels each against gravity. Exercise helps prevent the accumulation of the blood in limbs and stretching veins out of shape. So you can see the artery as a red color and the vein is pollution color. So connective tissue, smooth muscles, and endothelial wall, whereas the connective tissue, smooth muscle, endothelial wall, and the walls are present in the uh, arteries. The heart produces the pressure when it contracts. The force blood on the arteries walls, known as the blood pressure. The blood pressure decreases when the heart relaxes, but there must always be some pressure to keep the blood flowing. Doctors measure the blood pressure with uh, a sphygmomanometer, recording two numbers. Systolic pressure forces the blood felt in the arteries when ventricles contract, and diastolic pressure force of a blood felt in the arteries when ventricle relaxes. So the average adult's blood pressure is 120/80, whereas the regulating of the blood pressure with the nervous system, sensory neurons at several places in the body detect the blood pressure and send the impulses to brain stem, medulla oblongata. When too high, the autonomous nervous system releases the neurotransmitters that cause the smooth muscle around the blood vessels to relax, lower the blood pressure. When too low, neurotransmitters are released that cause the smooth muscles to contract and elevating blood pressure. When with the endocrine or excretory system, hormone produced by the heart and other organs cause kidneys to remove more water from the blood when the blood pressure is too high, releasing the blood volume and lowering the blood pressure. So disorders like the disorders of a circulatory system are very common. High blood pressure, heart attack, stroke are most stems from the atherosclerosis, fatty deposits, plaque, blood builds up on the walls of the artery and are obstructing the blood flow, increasing the blood pressure and risk of a collapse. So, atherosclerosis or atherosclerosis of the class can causing the blocking of the arteries or causing the hypertension. The high blood pressure force the heart to work harder, which may weaken the or damage the heart muscles and vessels. So more likely to develop the heart disease, increase the risk of a heart attack and strokes. So the heart attack are myocardial infarctions, a medical emergency. Coronary arteries supply the blood, brings the oxygen and nutrients to the heart muscle itself. So the blockage of a coronary artery may damage or kill part of the heart muscles, myocardium due to a lack of oxygen or a heart attack. The symptoms include the chest pain, pressure, feeling of a heartburn, indigestion, sudden dizziness, brief loss of consciousness, uh, or strokes. The blood clots may break free from the vessels and get stuck in the blood vessels, leading to the part of the brain that causes the stroke. The brain cells relying on that vessel may begin to die from a lack of oxygen, and brain function in that region may be lost. So the stroke can also occur when a weakened artery in the brain bursts and flooding the area with the blood. So this is a brain hemorrhage. So this stroke may develop in the uh, cardiovascular system. So if you want to prevent the diseases from a cardiovascular system, that's easy to prevent. You have to exercise, increase your respiratory system efficiency, weight control, reduce the body fat and stress, then sensible diet, low in saturated fat, reduces the risk of heart diseases. So you can prevent your diseases. If you are a smoker, you should have to stop the smoking so that the heart diseases may not be produced. Thank you very much. It's a little bit longer lecture. होप करता हूँ कि आप इसमें अपने आप को प्रिपेयर करेंगे एंड देन आप शेयर करेंगे इस लेक्चर को विद द अदर स्टूडेंट्स और सब्सक्राइब करेंगे इस चैनल को कि आपको जो कमिंग लेक्चर्स हैं वो रिसीव होते रहें. Thank you very much. I will submit all the syllabus through this channel so that you must prepare, and the other students, coming students or other fellows may have to even discuss these lectures, and definitely I will improve these lectures in coming sessions, and definitely you will share these lectures with your friend. Thank you very much.